The surgery for Peyronie's disease is usually after medical therapy has failed and the condition is stable. So usually we would allow the condition to become stabilized over a period of about 9 months or so, because you certainly wouldn't want to operate if the condition was still potentially going to get worse. So when you come to surgery, you have an options. You have options to just straighten the penis, or if patients also have erectile problems that don't respond to various medications, then of course you have the option to treat that at the same time. So let's talk first about just straightening the penis. If you have a curvature of the penis, you have one short side and one long side to the penis. The simplest operation, called the Nesbitt operation, shortens the longer side of the penis. This is a very reliable operation. It comes in various forms such as Nesbitt, Yahir, 16 dot, stage, all sorts of different operations, but basically all categorized under the same title of Nesbitt type procedure, which shortens the longer side of the penis. The operation has been performed for over 60 to 70 years, and this in itself will tell you that it's a good choice. It does not change the quality of the erection, but of course it does shorten the penis somewhat, and it shortens it depending on what the original curvature is. So those patients with curvatures of under 60 degrees will probably have a very small amount of penile shortening, and this will probably be a good option for them. Now those patients with quite advanced curvatures, more than 60 degrees, perhaps it would be better to have the alternative, which is to lengthen the shorter side of the penis. This is known as a plaque incision and grafting operation. It is a little bit more complex because you have to mobilize all the blood vessels and nerves where the plaque is on the top surface of the penis. And by and large, it takes 2 to 3 hours to perform. And the post-operative course is a little bit more prolonged than the simpler procedure. Having said that, the penis is straightened, less length is lost, but the downside of this operation is erectile function may deteriorate in up to 20% of patients. And so patients are often warned that they may need to take medication for their erections after. As I've said, if the erections are poor to start with, then perhaps it's best not to just straighten the penis, but to straighten the penis and treat the erection problems at the same time. And this would be by the insertion of a penile prosthesis. We would tend to use an inflatable penile prosthesis, which gives more of a natural type erection. It will straighten the penis and can lengthen the penis where the Peyronie's plaque is. And so this seems to be quite a good option for those patients with either advanced Peyronie's disease or significant Peyronie's disease with erectile dysfunction, perhaps from their diabetes or their blood pressure management. But either way, it is important to go through and be fully evaluated, to have a discussion with your consultant to know what is the best operation for me if I failed the medical therapy to start.